Afternoon, good evening, depending where you're joining us from today, because we have people joining from all around the world. Thank you for attending our very first BioFlex Laser Therapy Clinic webinar. We've always wanted to do this, and finally it's coming together. So thank you again for joining us today. Today we'll have Slava, our Director of Medical Operations. He's been working with us for 23 years, talking about laser therapy for arthritis. And a couple housekeeping things that I'd like to go over before we start the presentation is feel free to ask your questions in the chat box or Q&A box, depending on whether you're joining us from a phone or from your computer. And then we'll try our best to answer accordingly. And if we do miss some of the questions, we apologize, but there'll be contact information at the end of the presentation where you can feel free to email us or even call us. I do suggest, like, if there are any personal kind of medical questions, please kind of keep that to yourself and maybe contact us like by call or email and we can answer them individually. Other than that, my name is Dr. Nathan Chung. I'm a clinic director here. Here on my right, you'll see Slava, which will be presenting the webinar today. Thank you.
Thank you, Nathan. Good afternoon, everyone, and thank you for joining us today. So indeed, based on our extensive experience with the BIOFLEX Laser Therapy technology development, manufacturing, and clinical applications in the last more than 35 years, today we would like to share with you with our knowledge, expertise, and experience in treating osteoarthritis. And of course, the immediate question is, why osteoarthritis? Out of all of the musculoskeletal or any other health issues we decided to talk about. First of all, osteoarthritis affects a significant number of Canadians, and an estimated 4.5 million people right now as we speak suffering from this condition. With an aging population, it is expected that by 2040, roughly 12 million patients will be suffering from this. And it is a leading cause of disability, limiting daily activities, affecting night sleep, work for many, many patients. And also with age, it is increasing in its symptoms and its severity, becoming more and more chronic, inviting more health conditions such as hypertension, COPD, depression, and fatigue. Also, osteoarthritis, it's a clinical syndrome. It's just not one symptom, but it does involve few issues such as joint pain, dysfunction. It is caused by underlying degeneration and affects more people than in one joint of the body. So there are no consistently effective methods at this point in time or any particular remedy to prevent osteoarthritis, to slow it down. So that is why existing approaches are very limited for many patients around the world. Why is it also getting worse in the winter season? I hear this question pretty much every day and every year. So winter often makes symptoms worse due to a few things. Cold temperatures, they stiffen joints. And the first thing that patients feel in the morning, that they have this inability to make even first few steps. Then it decreases activity, leading to the weakness of surrounding muscles, causing secondary muscle atrophy. Also, it is very sensitive to atmospheric pressure fluctuations. When there is a rapid change in atmospheric pressure, patients with osteoarthritis will tell us. Cold also can make synovial fluid, which is a natural lubricant for all of the joints. It becomes thicker, it is slow in circulation, and it just adds up more to that increasing stiffness and pain in the joint. So what is osteoarthritis? It is a progressive disease of the whole joint and most commonly affects the joints such as hands, feet, hips, knees, and the spine. Even though the spine, human spine, is very long, stretching all the way from the head, from the cervical region down to the sacrum, many of those joints, smaller joints, can be affected by osteoarthritis. And pretty much any joint in the human body can be affected by osteoarthritis. So what solutions available these days? While there is no specific cure for osteoarthritis, Normally, you would hear recommendations from your family physicians or general practitioners, therapeutic exercise, just to keep those joints moving, to maintain range of motion. Of course, taking pain medications when you feel like you need some help to relieve symptoms. And in severe cases, surgeries can be recommended. If, let's say, it's a far gone, advanced degeneration, then certain joints can be replaced these days, such as hip joints, knee joints, shoulder joints. And physiotherapy, massage, and acupuncture can help improve mobility and reduce some of that tension throughout the body. But most commonly, anti-inflammatory medications off the shelf, sometimes prescription medications that can be formulated specifically for any particular case scenario, and also steroid injections, more powerful anti-inflammatory remedies that usually would be injected into the joint itself. At some point in time, there were very popular hyaluronic acid injections, but then along with arthroscopic procedures, they've been found with very little benefit to patients. In fact, every time there is intrusive, aggressive procedure involved, in fact, it accelerates degenerative osteoarthritis on the inside. So speaking about laser therapy, obviously, I would like to share with you some of that research. First of all, I want you to know that it is a very well-researched, documented healing modality. There are multiple journals, medical journals available these days, accessible for the general public and medical professionals. And this is where you can find some of those latest up-to-date research papers. I would like to share with you, just with very few, some of most recent ones, such as this one that was published in 2019 in Photomodulation for the Medicine and Laser Surgery Journal, Applications of Photobiomodulation Therapy. This is how laser therapy is called these days, to musculoskeletal disorders and osteoarthritis with particular relevance to Canada. Again, why to Canada? We know climate, the long winter season, cold temperatures. So the field of photobiomodulation to treat musculoskeletal conditions, osteoarthritis, expanding exponentially. And over the past 20 years, there is increasing good quality publications available on this subject. So now the idea is not only to find a solution to relieve symptoms, but truly to understand better the physiology, the underlying pathophysiology, and to find best possible treatment protocols, approaches, dosages. So in this study, they suggest a growing body of evidence indicating efficacy. And look at this, very important, almost total lack of side effects should encourage continued clinical research and clinical applications. The main reason behind, as we all know, unfortunately, many pharmaceutical potent, very effective medications still would have a toxic effect on human body. And as an example, it was well published in 2004, anti-inflammatory medication Vioxx. It was pulled from the market by Merck amid lawsuits because implicated in causing between 88,000 and 139,000 heart attacks, 30 to 40% of which were fatal. Then, in an effort to steer away from the use of anti-inflammatory medications, doctors started prescribing painkillers. And we've started observing a growing epidemic of deaths due to opioid overdoses. So that is why still, with the good intention of helping patients with osteoarthritis, pharmaceutical approach not necessarily is the best. So this article was published in 2023, International Journal of Molecular Sciences, the mechanisms and efficacy of photomodulation therapy for arthritis. It was a comprehensive review, so that's the most valuable type of research and publication you can find. So photobiomodulation has emerged as a promising treatment approach in recent years, and effectively it is reducing inflammation when we utilize red and near infrared light emitting by laser or LEDs. So in contrast to any modalities that will be producing heat, laser works differently, and photobiological response at the cellular molecular level regulates the functional response, reducing inflammation. This is systemic and local effect on the human body. Anti-inflammatory properties and beneficial effects in arthritis treatment have been reported in numerous studies, including animal experiments. This is when researchers can take a sample of tissue as a biopsy, look at the microscope, and see how laser can help to achieve specifically tissue regeneration. So that is why the photobiomodulation effectiveness in arthritis treatment has been extensively researched in specific cases. This comprehensive review emphasizes the effect of laser therapy photobiomodulation as an effective, non-invasive arthritis treatment. Therapy shows great promise as an effective and non-invasive treatment for arthritis. And also, it provides valuable insight and guidance for researchers interested in further exploration and investigation how laser works for arthritis treatments. And one more paper I'd like to share with you. It was published in Medical Lasers Journal 2024, Phototherapy for Osteoarthritis Management, narrative review. This research was done in South Korea, university in South Korea. And this review examined studies conducted in the last 10 years to determine the potential of light-based therapy, light therapy, photobiomodulation, laser therapy, and specifically how it works for articular function, how it works to repair the cartilage layers of the joint. And various studies have investigated the efficacy of therapy, particularly a laser in alleviating pain, improving functionality, enhancing the repair of cartilaginous elements of the joint in patients with osteoarthritis. So efforts have been made to investigate the potential how to regenerate cartilage that has been damaged inside of the joints. And this diagram, you can see how laser irradiation, the photonic energy that is capable of penetrating inside of the joint, can activate cells, molecules, reducing inflammation, then introducing patients to exercises, stretching, muscle strengthening, with ongoing photobiomodulation, continuously working on tissue repair, therefore reducing pain, increasing functionality, and helping patients to reclaim, to gain back normal lifestyle. So that is why, once again, laser therapy presents a non-invasive, well-tolerated option with a variety of potential benefits for patients with osteoarthritis. Now, after all of that research, I would like to make few most practical, most relevant points about clinical effects of laser therapy. First of all, it helps to improve the vascularization, the blood supply at the smaller, at the tissue level when laser promotes angiogenesis. Then collagen production, it's a framework for any type of healing work that will be happening in the human body. Muscle regeneration, strengthening those muscle fibers, reducing inflammation locally and systemically, reducing the swelling of the joint. It's called edema. And yes, regenerating those damaged nerves, working also on pain relief, previously mentioned cartilage production, and even bone formation, healing the bone. Yes, indeed, we're seeing patients with bone fractures, with post-surgical conditions, as mentioned previously, knee replacement, hip replacement. This is when laser helps to promote bone regeneration. So this is a quick, again, summary about the advantages of the BIOFLEX laser therapy system. It is non-toxic, non-allergic, non-invasive, easy to apply. It does not have any known side effects. It's absolutely safe. No complications documented so far since early 60s. It is also very cost effective. It helps to reduce the cost of osteoarthritis management for patients and for healthcare practitioners. Then also it is very important. Many seniors would have already certain other underlying conditions, and they may have pacemakers, metal implants following fractures, or artificial joints. It is not contraindicated for those patients because there is no interaction between the laser beam, the lights, and those foreign objects. So transplants also very safe. And even if somebody would be taking medications or even some other additional medications for cardiovascular issues, it is not contraindicated. So the bottom line, it is effective and it is very safe healing modality. So again, how laser works in real life situation when patients come to the clinic like ours, they expect to achieve few things, very specific things: tissue healing, pain relief, inflammation reduction. And this will bring them to the next level, improving the function in their joints, in the body, better mood, obviously, because chronic issues, chronic pain can drive patients into depression and obviously disrupting their normal sleep patterns. Also, it will help to get back to work. It will help back to, again, making a living. And also, another significant benefit, staying away from potent pharmaceutical medications. So this is a quick summary about advantage of using laser for osteoarthritis. At
Thank
this
you,
point in
Slav.
time, yes, Nathan, maybe there are some questions.
So a couple things I want to highlight for those of us joining later is very interesting facts. 4.4 million Canadians suffer from osteoarthritis, and that number is growing. They project it to be 12 million by 2040. Something interesting I looked up, you probably know too, Slava, that if we take the worldwide facts, it's 528 million based on World Health Organization. And by 2050, that's going to grow to 1 billion. So quite a lot of people around the world affected by osteoarthritis. And although there's no cure for it, what we do know working at this clinic is there's a lot you can do to basically relieve the symptoms, such as improving your overall quality of life by exercising, managing your weight, eating healthy, and guess what? Laser. And that's why we're here today to learn more about that. One particular question would be like, are the treatments painful?
Treatment's absolutely not painful. Like I said, they're very friendly. And I think it's worthwhile to mention, we see children even, we see teenagers when they come with their sports injuries. And children don't like anything that would be causing any kind of pain. So it's very relaxing, it's very easy to apply. And usually patients relax and comfortable during the treatment session. They wouldn't feel anything else except maybe some pleasant warmth from treatment devices.
Thank you. And then at the end of the presentation, we'll also leave time for more questions. Next, we have some few case studies that are patients that have come to our clinic and have been successfully treated by the laser.
Thank you, Nathan. So I would like to discuss with you a few cases indeed that would be very common as we see those patients on a daily basis, like this one, a 59-year-old electrician who came with a progressive pain in the left hip, and problem started 2 years prior to that when he was skiing. So he fell down and couldn't get up. It was quite a severe injury. So eventually he was diagnosed with a hip degenerative osteoarthritis. Plus, you see this word, osteonecrosis. I will tell you what it means just in a few seconds. When we did physical examination, we've measured all the angles, degrees, range of motion, circumference. Indeed, there was a lack. He was losing range of motion. There was function affected and restricted. And underlying pathology was revealed on imaging, on instrumental imaging test results. So the left hip demonstrates osteonecrosis of the femoral head and subchondral lucency and sclerosis. What does it mean? This is the illustration. The smaller caliber blood vessels, capillaries, okay, they've been not present. Some of them perhaps have been damaged or chronically ill, so to speak. And the bony tissues experiencing ischemic changes have been suffering. Therefore, the nutrients that should be provided through the blood flow to collagenous elements, to the joint socket, they were not there, they were present. So slowly but surely, not only joint surfaces, but even bony structures of the hip have been affected. That's why it's called osteonecrosis. Also, the difficulty, the challenge of treating hip joints, it's protected, it is covered by large muscles in the human body. So the joint itself is built of the largest bones in the human body, but then it's protected by the muscles. So laser, as a non-invasive treatment, allows us effectively to go through those layers of tissues and reach those deeper layers of tissues, stimulating the healing. The treatment plan for this patient was the following. In the first week, we've treated this patient Thursday, Friday, Saturday, back to back on a daily basis. And then in the following week, 3 treatments every second day, followed by 2 treatments per week in the following 2 weeks. So the idea was to initiate the healing process, give that initial boost, and then continuously stimulating and taking the patient through the treatment course. Clinical outcomes. After 7 laser treatments, patient noticed a substantial improvement in symptom relief, in his range of motion, and decided to take a break to go on vacation for 2 weeks to the Caribbean area. So he then resumed his treatments upon arrival back to country, and after 11 laser treatments in total, we have introduced him to the use of a portable home system. We have those systems available for the convenience of patients to continue treatments at home if continuous stimulation would be beneficial to promote further tissue regeneration. And this patient, he did so. This is how this portable device would look like. It's easy to apply. Patients can even travel. So snowbirds, they like taking it to, let's say, Florida or Arizona or California. It's very light, and they can continue with treatments that they've initiated at the clinic utilizing professional grade equipment. So it's quite nice. Also, like I said, it's a cost-effective solution. So on MRI also, with the same patient, there were some degenerative changes observed at the level of L3, L4, L2, L3, and L4, L5 level. Bulging discs. That is why there was some pain and discomfort and muscle stiffness. So also, he was developing a narrow central canal, okay? So a diagnosis was multi-level degenerative disc disease of the lumbar spine. So quite a few of those joints have been affected. Treatment also was initiated for that patient, and during the follow-up assessment, patient was symptom-free and pain-free, medication-free, resumed normal daily activities, was able to work full-time as previously. So we have reminded this patient maintenance treatments would be necessary because with aging, degeneration will be still there, and from time to time, flare-ups can happen during the winter season. So patient was discharged from our care completely. He went on vacation to Croatia for a month. Then he was back for assessment. So technically, we continue supervision of this patient because now he does have that flexibility, this freedom of treating himself with a portable system. Another case, 43-year-old commercial airline pilot, not as old, but physically active. So he was playing beach volleyball 3 years prior to showing up at our clinic and injured himself. So what happened? His left foot was planted and he twisted and immediately felt this severe pain in the joint. So he's been seen by a specialist who advised arthroscopic procedure, but he declined, which was a good decision on his behalf. Symptoms subsided eventually, so they were no more kind of acute, but eventually the pain has become more and more severe. Swelling in the joint, a restriction in the range of motion. Eventually, he was slowing down with his physical activities, and he started utilizing analgesics. On physical examination, when we saw him initially for initial assessment consultation, again, all the measurements have been done, and we have noticed that he started losing the function in his joint. But at the same time, there was no significant instability, which means there was no structural damage, which is a good news. So then, the left knee imaging ultrasound showed us something about soft tissues because ultrasound cannot see all the elements of the joint. So we've noticed moderate suprapatellar joint effusion, but also some of the portions of the medial meniscus somewhat within normal limits, maybe yes, maybe not. And obviously MRI would be a better solution for that. So this is how traumatic arthritis would look like on the inside when there are no obvious structural damages, but still joint surfaces inflamed, painful to walk, and we're looking at those meniscus, medial, lateral, ACL, PCL seems to be in place. And this is also, you can look at the model, the illustration of the healthy joint versus the knee that would be suffering from osteoarthritis. This is how the treatment was initiated for this patient. 2 treatments in the first week back to back, the same thing the following second week, and then 2 treatments per week, but having some spacing in between so that the body would absorb the energy, metabolize it, produce the healing effect, and then it would be ready for another dosage. This is how we treat our patients for knee problems. We utilize the treatment array, large surface array that is able to cover the entire compartment of the joint. This is where we see the joint line, the projection of the medial meniscus, the posterior horn, the kneecap, the infrapatellar space. Then we shift the treatment array to the outside of the knee, covering the lateral aspect. Same idea to overlap the kneecap, the tendon, then focusing on the lateral meniscus. And then we go to the back of the knee, the so-called popliteal fossa. This is when patients with osteoarthritis sometimes may have a Baker's cyst. So we irradiate all of the compartments to make sure nothing will be missed. The synovial joint, fluid, all the elements, ligaments, inside, outside, will be treated effectively. And then we utilize these laser probes when we precisely exactly target those specific structures, and laser beams, they penetrate inside of the joint, so they deliver even more energy, the energy that is needed for stimulation at those deeper levels of tissues. Laser probes, you see, red and infrared. So in the same case, eventually patient has had MRI of the left knee. Those are few important findings. Large joint effusion with synovitis and the recent rupture of the Baker's cyst. You see, we have made the right decision treating the posterior aspect of the joint at the back. A complex tear of medial meniscus that hasn't been seen by imaging ultrasound, but MRI was able to reveal it. And very mild osteoarthritic changes along the way on the inside of the joint in the medial compartment. So ligaments did not suffer. Everything was there. After 6 laser treatments over 4 weeks period, patient was at 70% of overall improvement, medication free. He resumed normal daily activities and was able to fly a commercial plane from Toronto to Seoul, which is a very long range flight, like I believe it's 11 or 12 hours. So that was a good test for him. Then maintenance laser therapy treatment course was recommended for this patient in the future to prevent further degeneration or development of osteoarthritis. And considering his traveling, his schedule, okay, so we have suggested also utilizing a portable home system so that he can treat his knee soon after beach volleyball if there will be any re-aggravation, irritation to those tissues, so he can avoid surgery or any other treatments that would require intrusive, invasive approach. Once again, I will take a pause and perhaps we have some questions. Nathan?
Thank you, Slava. Actually, you just touched upon the portable home device. We actually have a question from Randy and Susan. They're wondering if the P180 is interchangeable with laser therapy when we were talking about the benefits of laser. Very good question.
So personal systems that have been designed by our company would be somewhat a derivative from the professional grade equipment. But because of the laser safety regulations, obviously the company cannot sell laser probes or more powerful devices to the general public. So that is why portable systems with the treatment array that we have would replicate the first part of the treatment, similar to what we do at the clinic. The only piece will be missing those laser probes that can be operated only by trained, certified healthcare practitioners. Thank you.
Yeah. And we do have a lot of patients who own our systems who come into our clinic continuously for laser probes, more as a boost to the benefits they are obtaining with their home system. And typically this would range from once a week to as little as once a month. So very helpful to kind of accommodate both. Slava, we don't have any more questions right now, so the next few slides will cover some more osteoarthritis of the knee, and then we will eventually finish off with lumbar spine. Thank you.
Thank you. Let's carry on. So the advanced degeneration. Now I would like to tell you about this case, a 79-year-old man. So he was walking and unfortunately slipped and injured the right knee. But when he presented himself at the clinic, there was acute pain in the knee. So he was barely walk. Obviously, at home, he tried doing whatever he could, icing, resting, elevating the knee. Previously, he has had an arthroscopic procedure done on the left knee, and that was also including medial meniscectomy, which means meniscus in the middle compartment of the joint has been removed. So that was 10 years prior. So now he ended up with chronic pain in the left knee and very acute on the right due to a most recent fall. On physical examination, yes, there was a lack of range of motion and quite obvious changes even on the outside in his knees. So tenderness, inflammation, swelling in all three compartments on both sides, on the inside, outside, at the back of the knee, and more severe on the right side, especially in the area around the kneecap, but no instability. So that was the only good news at the time. Once again, I would like to show you and explain so what can happen with that advanced degeneration. When you look at the healthy knee, you can see those big, thick, juicy, shock-absorbing menisci on the inside and outside of the joint. And along the way, over the course of years of wear and tear and degeneration, eventually they can even disappear, those menisci. Or if there will be any traumatic episode, they can be easily torn because they become so thin. But also, please pay attention, this weight-bearing tibial plateau, the one that is bearing the weight of the body, eventually see the transformation, degeneration, bone spurs, osteophyte formation. Also, that creates a lot of pain for patients. Then, when you look at the X-ray, you would see those changes. Obviously, we cannot directly see menisci, but you see how the space, the joint space has become so narrow. And sometimes patients, they say, oh, I have this bone on bone situation when with every step, I feel like my femoral bone is pushing against my tibial bone. So this is how it looks on the inside on the X-ray. So for this advanced degeneration, we have offered more aggressive treatment plan. As you can see, initial 3 treatments done in the first week back to back, then 3 treatments in the following week. Again, for the same reason, to deliver as much of energy as possible, as deep as possible, initiation of the cellular processes and reducing inflammation as quickly as possible, which will mean for the patient less pain. And then observing positive changes, that's when we switch over to twice per week. One more thing I would like to mention that once in every 2 weeks, we do reassessment, reevaluation, and even for patients who would be using then portable systems, we advise them, please come, schedule consultation. We're going to check on your progress. We're going to give you additional tips and recommendations, but also you're going to have those laser probes done at the clinic during your consultation. So advanced degeneration both knees. Another patient, 78 years old, he came complaining about pain in both knees, left more severe. So what happened? While playing golf in Florida, he fell and felt a snap in the left knee. When patients hear a snap, that's not a good news, I have to tell you. It means that something was torn or something was damaged, and usually it's a sign of a immediate attention that is required to the joint. So then he said yesterday he was struck by a large dog and he fell down with severe pain, and it's difficult for him to walk, and he feels it exactly in those weight-bearing areas. The right is also severely affected, but more chronic in nature. So when you have patients complaining about pain in both knees, obviously it's a very serious situation. It's a very sad situation. On physical examination, severely restricted range of motion, you see a lot of swelling, a lot of redness, pain on palpation, tenderness along the joint line, and in all three compartments. So X-ray, okay, obviously the lab was able to look back at previous images, which is a very good thing to see the sequence. So this is what they say: over the course of previous 8+ years, few radiological imaging tests have been revealed a progressive degenerative osteoarthritis in both knees. Patient has been recommended to have an up-to-date MRI test, okay, because of that snapping sound and because of some more severe pain at this point in time. And also, he was so bad that perhaps he would be a candidate for a knee replacement surgery. So, considering all of those factors involved, considering all these symptoms involved, treatment for this patient was even more aggressive. Look at this: 3 treatments back to back. In the following week, again, back to back, 4 treatments, followed by 3 treatments week number 3 every second day, and only after that, reducing frequency of treatments down to twice per week. I will pause.
We certainly see a lot of knee patients at our clinic. I looked up some facts, Slava, based on World Health Organization again. Out of that 528 million worldwide, according to them, 365 are knee osteoarthritic patients, which is a very shocking number, considering we do see quite a lumbar spine patients at our clinic as well. I think at some point we were seeing 40% of our patients were lumbar spine patients, but they probably don't take into account that number because most of the lumbar patients, although it shows up on X-ray that they have severe, moderate osteoarthritis, they may not present with the symptoms. So World Health Organization probably doesn't take into account that number, but we indeed do see a lot of low back patients. I think someone has a question about knee replacement. Is it recommended to do treatments before or after, or does it matter?
It's a very good question. And let me tell you, to minimize any possible risk of post-surgical complications, but also to speed up rehabilitation and recovery after surgery, every orthopedic surgeon would tell you it is always better to operate on the knee, on tissues in general that would not be inflamed, because that involves a lot of bleeding during the surgery. And also, it will minimize the possibility of having infection after the surgery. So my personal recommendation and observation, it's better to have few treatments done before the surgery so that orthopedic surgeon will do a good job during the procedure, and then initiation of the laser treatment soon after the surgery. And we've done that previously, and I do have some of those even pictures to show how patients after knee replacement surgery recovered beautifully, expediting healing, pain relief, rehabilitation, exercising. And when patients go to see orthopedic surgeon for the follow-up assessment, those who have had a surgery, they demonstrate excellent results. I've done this for my own mother-in-law after hip replacement surgery. She was the fastest healing patient on the floor, and we've done that so many times for my patients at the clinic. Okay, so that was a very good question. Thank you.
Thank you. Oh, thank you, Slava. One more question tying into this. Can people continue their normal daily activities after each session of treatment?
Yes, there is no downtime involved. You will maintain your normal daily activities. The only thing I would suggest, avoid anything that will be excessive so that you would not undo all the good healing work with the laser and then, let's say, going and running half marathon or something like that. I would suggest normal daily activities, but be mindful, protect, preserve those tissues that will be healing and regenerating for you with that laser stimulation.
Thank you, Slava. We have a couple more questions. I'm going to save them for the end so that we can kind of continue uh, for our next few slides talking about lumbar spine, but we definitely have a couple more interesting questions to come. Thank you, Slava.
Wonderful. So our next case, look at this 86-year-old executive who has low back pain dating back many years. Chronic case, well diagnosed. So an avid skier who fell while on the slopes in April of this year, sustained fractures in several ribs. Look at that. Chronic low back issue, degenerative disc disease, and rib fractures. So the low back pain has become relatively acute, particularly while walking, restricting normal daily activities to a severe degree. And then he has had laminectomy 8 months previously, when one of the disc has been removed because of the pain, but still post-surgical area was hurting him. And also he was on a list of cardiac medications, plus taking anti-inflammatory medications, plus OxyContin, codeine. So it was a chemical cocktail in his body, I gotta tell you. On physical examination, we found quite moderate restrictions in all the range of motion, flexion, lateral, anteroflexion. Uh, then we've noticed some biomechanical misalignments and changes in his spine, such as kyphosis of the thoracic spine. And then also it was involving his hips. We've noticed he started developing advanced osteoarthritis in his hip joints. The MRI of the lumbar spine revealed quite severe chronic multi-level pathology. Look at that, from L2, L3, all the way down to L5S1. And look at that, mild to moderate bilateral foraminal narrowing, and then severe central canal stenosis and bilateral mild foraminal narrowing. I will show you some pictures to explain a little bit more, and other levels also affected. So this is what foraminal narrowing means. Along the spine on both sides, we have those windows. Anatomically speaking, they open foraminal narrowing. Those are the exit points for segmental nerve roots. And when there is narrowing, impingement, inflammation, it becomes radiculopathy, the source of that shooting pain that then can shoot all the way down into sciatica, into buttocks, etc. So in this particular case scenario, with advanced degeneration, there were few levels affected on both sides. And that is why the entire lumbar spine was on fire, plus those muscles supporting the spine were in spasm because they were trying to protect, to immobilize the lumbar spine. That's why range of motion was severely restricted. So in addition to that, rib fractures, remember, as a result of the fall, and it's not unusual. Very often, patients at certain age would have few issues, and we always look into all of those few issues. That's why sometimes we have patients coming and having treatments on the same visit, at the same time, lumbar spine, knees, shoulders, like in this case, rib fractures. It's not so unusual when patients would have chronic and multiple health issues that can be treated on the same visit at the laser clinic. So for this patient, we've done his low back treatments, like I said, initially in the first week, 3 times back to back, then 3 treatments every second day on a second week, and then reducing the frequency down to twice per week. I would say this would be now a standard conventional approach when we treat somebody with osteoarthritis at the clinic. So this is how treatment is done on the lumbar spine. Once we know what is on MRI, so we match those findings with physical examination findings, and then we mark on the skin, like in this case, L3, L4, L5, S1 levels. So this will be our treatment perimeter, the bull's eye, so that we can target with the laser effectively. And then utilizing treatment arrays, placing them over those affected areas. Also paying attention to the foraminal openings, the pathway, the origin of the nerve roots, the sciatic nerve origin, sacroiliac joints, left and right. And then remember the central canal stenosis. We have to treat the central aspect of the spine, and this is how it's happening in the real life situation. You can see the side view, flexible treatment arrays that follow the curvature of the lumbar spine, and also muscles, myofascial layers will be treated effectively at the same time, followed by the application of laser probes. So this is when we utilize both red and infrared. Again, the intention is to get down to the bottom of the problem, affecting those facet joints, foraminal narrowing, and nerve roots origin, where the pain is. After 14 laser treatments, within 2 months period, patient was at 80% of overall improvement and pain medication free. So he resumed his normal daily activities, was introduced to the use of a portable system. We've shown him stretching exercises and recommended swimming as a form of physical activity. In fact, I would suggest swimming to anybody with knee problems, with spinal problems, as the best form of exercising. And then in the following month, he went on a deer hunting trip. So he surprised us and his family, and it was nice to hear. He was so comfortable and confident in doing that. So then we've suggested maintenance laser therapy treatment course in the future to prevent further degeneration, especially to keep an eye on the central canal stenosis situation. And then again, he said, I'm not going to quit my downhill skiing. He went to Montana for 4 weeks of downhill skiing. In the summary, laser therapy. It should be considered as the treatment of choice in the management of osteoarthritis, no matter what the body part will be affected. It helps us to achieve few things, important things for patients: elimination of pain, reduce, obviate the need for drugs, unnecessary surgeries, restore the normal range of motion, and improve quality of life of our patients. Now I think, Nathan, we can take all the questions.
Thank you, Slava. So we do have a question here from Carol. Once the damaged joint is treated and the patient is able to function normally, typically how long do these benefits last? Like, is there going to be a requirement to do any further treatments?
So, according to the science, according to the research, the amount of energy delivered to tissues during the treatment course physiologically will last for about 4 to 6 weeks. So this is when cells will be actively, continuously doing the work. And then eventually that stimulation will slow down, we'll get to the plateau. Point number one. Point number two, when it comes to symptoms and function and activity levels, this is when the patient will be in charge, observing, listening to the body. Okay, is it time for me to have maintenance treatment? Do I need another consultation? Or something else should be done, let's say physiotherapy, perhaps to modify my exercises. This is when you have to combine the effect of laser therapy, physiological activity at the cellular level, and just clinical judgment. This is when we can help our patients to go through other steps of rehabilitation.
Thank you, Slava. There's actually another interesting question. So Maureen has a home system. She's wondering about the bars of intensity. So the 4 bars, what do they actually mean? This is an interesting question because I do remember when Dr. Khan first created these systems, we were reviewing protocols. So indeed, every level from 1 to 4 and every placement anatomically does have a dedicated different protocol. Although it's not publicly posted in any booklet, we did go through each individual protocol, finalize and select them derived from our very own clinic protocols to install into those systems. But perhaps, Slava, you could elaborate a little bit more on that.
So without going into specifics in the physics of the light, otherwise this will bring us to Albert Einstein, those levels of intensity designed for one purpose and reason only: to overcome a physiological plateau that the human body will eventually develop at some point in time. In different individuals, different patients, it happens at different times. So when the body reaches that plateau, that's when we can go to the next level of intensity to give that boost, the awakening boost, so to speak. At the same time, please remember, more does not necessarily mean better. And especially if you're treating something that is related to acute inflammation, acute pain, please do not use high intensity parameters. It is always better to initiate the healing, pain relieving efforts using lower settings. And then as you'll be feeling better, more comfortable, that's when you can advance to the next level. Normally, it takes somewhere between 2-3 weeks of treatments at the same level of intensity before you would consider moving up. But if you're doing well, you're responding well, do not, do not change a thing. Stay at that same level. Thank you.
Tennis elbow. Can laser therapy help with tennis elbow? Someone's asking.
The short answer is yes, and I'll give you a heads up. We have prepared a separate lecture on the subject of epicondylitis, rotator cuff injury. We're going to talk about that in more detail, but the short answer is yes. Laser therapy has been found, researched, documented, effective in the treatment of epicondylitis.
Does laser therapy is it only effective for osteoarthritis, or are there different types of arthritis that we see at our clinic?
Good question. Good question. I would say educated question. Yes, we have treated patients also with other forms of arthritis. To name a few, the most common would be rheumatoid arthritis, which is more of an autoimmune condition. Another example, also autoimmune, psoriatic arthritis. And what we see happening, yes, treatment approach will be slightly different, less aggressive. Treatment parameters, dosages will be utilized a little bit different. But yes, indeed, laser therapy, photobiomodulation has been found effective even for those not so common, not so typical forms of arthritis.
Thank you, Slava. We have another question here from Mary. With spinal stenosis and osteophyte formation, restriction in epidural injection, what is the best protocol for treatments as she does not live near our clinic?
Okay. Um, the geographical factor when patients live far away from us and we cannot help those patients directly, I can suggest one thing. To learn more about the specifics, about details of your specific health condition, I would recommend scheduling with us at least a video call consultation so that we can discuss directly with you all of those details involved. But then, if you would be a good candidate for laser treatments, perhaps utilizing portable system at home on your own under our guidance and supervision would be the best solution for you.
Don't see any more questions. Are there any contraindications to doing laser if I'm having steroid injections or cortisone injections, or even like PR injections?
So, corticoid and steroid injections, not contraindicated. It's just a recommendation. You should wait somewhere between 3 to 5 days after the injection to give your body a chance to absorb steroids, metabolize, and do something about that. Also, you will know if steroid injection is actually helping you, working for you or not. And then you can initiate laser therapy. Next, PRP. In fact, I have a good news for you. I came across a few publications. Research has been done and it's been found. Now it's part of the recommendations for even family doctors. PRP plus laser therapy. It's a wonderful combination, delivering the best possible effect, therapeutic effect for patients for certain conditions. So please go ahead safely with PRP plus laser.
Is this treatment covered by insurance? I can answer this one being a chiropractor myself. So, yes, laser is covered under some insurance plans. It depends on the plan, obviously, how much coverage there is. At our very own clinic, we have a physio and a chiropractor. So, typically, most plans will cover it under that. Some plans may require a medical doctor referral, so every plan's different. In terms of the total amount, it does vary, but as long as you are seen by a physio and chiropractor at the clinic you're attending, it can be covered under insurance that way. Do we have any more questions? And don't feel that you have to ask all the questions now while we're live. As Slava and I have our emails there, and then the clinic email is there as well, and our phone number. Feel free to reach out to us anytime with your questions if they're more personal. I'll definitely take time to answer them. But if I don't see any more questions, there's a question from Randy about the slides, in terms of placement positions of the knee, if we can get a copy of that. So that one, Randy, if you can send me and Randy and Susan, send me an email, and then I'll kind of coordinate that with you. But other than that, it looks like we don't have any more questions. So on behalf of the BioFlex Laser Therapy Clinic, I do want to thank you again. So one thing I will suggest is um, send us your requests of future ideas for webinars that you might have, and we'll definitely accommodate that. There is one question, Slava.
Yes. Uh-huh.
Can laser therapy help with osteoporosis?
With osteoporosis. Perhaps you've noticed I've included bone regeneration. Indeed, laser therapy can stimulate bony tissues, osteoclasts, okay? And yes, research was done. When you adequately supply the body with building blocks, calcium, phosphate, you take supplements, vitamin D, laser stimulation will activate cells, tissues that will be metabolizing those supplements. And yes, indeed, when it comes to pain, discomfort associated with osteoporosis, laser is instrumental and beneficial. Thank you.
Okay, let's see. Well, thank you again. We hope to see everyone again next time at our next webinar, so stay tuned. Once again, thank you, Slava, for the presentation, and we hope you all have a wonderful rest of your day, evening, and we will see you soon. Thank you.
We'll be in touch. See you then. Bye bye.